Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about consolidation, prices, and value. It certainly is, and much of the current conversation, both within and outside of the industry, is focused on the question of whether consolidation leads to higher prices. But that may not actually be the right question to ask, at least not if we're looking forward. So let me explain. Today, healthcare isn't a textbook perfect market where the forces of supply and demand can operate to set prices without any confounding factors getting in the way. When consolidation takes place in an environment where market forces are blocked, significant price increases can and have occurred. The reality is that healthcare may never be a perfect market, but the market is shifting toward value, and that shift is moving the market in the right direction. It's not that simple. It's also not what I'm saying. The shift toward value is necessary, but it's not enough. If, and this is a big if, we also see payment level transparency gain traction, then we will see market forces operating to keep prices in line with value. I have spoken to industry insiders who downplay the role of payment transparency. They cite the current environment in which many prices are increased significantly post-merger. But let's be clear, any analysis of the impact of consolidation on prices has been in an environment with little price transparency. That's hardly a model in which consolidation can or should be evaluated. In a transparent, value-based environment, vertical consolidations would be made where they improve coordination and where advantages outweigh potential disadvantages. With payment level transparency, we would be able to see, even monitor, the impact these integrations have on price. That doesn't occur very effectively today. Here's another point. Healthcare is a fragmented industry, and it's unrealistic to think we can defragment completely without consolidation, achieving it simply through loose affiliations and contractual agreements. That's just too complicated to be the only care coordination model. Sure, take bundled payments. In an environment of payment level transparency, care components would have to be priced competitively to succeed in the B2B market. Acquisition decisions relating to care components could then be made within a straightforward make versus buy framework, just as other business sectors do regularly, taking situation-specific pros and cons into account. And with payment level transparency among care purchasers, including consumers, health plans, and employers, price variation for the entire episode would be reduced. When HFMA released its Value Project report on acquisitions and affiliations last year, we recommended that organizations contemplating such strategies should focus on whether a particular acquisition reduces the total cost of care to the care purchaser. That's the end game. So the right question, with regard to consolidation, is not about its impact on component prices. The right question is, what is the impact of a change in ownership on the total cost of care to the care purchaser? It's the same question we ask in every other industry, and we need to ask in healthcare. Remember this, consolidation is only a vehicle. Value improvement is the destination. Thanks for watching. I'll see you next month.